Welcome to ACTPod, a podcast show that sheds light on the stories and impact of the social sector. The show is proudly powered by Aspire Coronation Trust Foundation. Let's begin the change.
Hello there. You're welcome to yet another insightful episode of your favorite podcast show, ACTPod, our story, our continent. My name is Abiodun Owo, and I will be your host on this episode. So today we're going to be talking about something that is very, very important for you and for moi, and that is about eye health. You would note that a few days ago we celebrated World Sight Day, which is about bringing awareness to the need for us to take care of our eyes and to also have to take preventive measures towards, ensuring that our vision is optimum. And that is why today I'm going to be having a conversation with an organization that has been spearheading, the movement to ensure that millions and millions of people around the world take good care of their eye health. I have here with me the country manager of VisionSpring Nigeria, Abimbola Ogundirahun. How are you doing today?
Thank you very much, Abiodun. It's a pleasure being here on the show with you.
Thank you very much. Thanks for coming. Also, she's not here alone. We have someone who has also benefited from the great works that VisionSpring has been doing in Nigeria in the person of Mr. Ernest Eseka. Did I get that right?
Certainly you did.
Thank you very much, Mr. Ernest.
Thank you for inviting.
How do you say hello in your dialect?
We say Ajay for male, then Otofe for women.
Oh, okay. So if I wanted to say hello to you, I say Otofe.
No, for a female. But to me, you tell me Ajay.
Oh, I tell you Ajay. Ajay, Mr. Ernest. All right. You know, where I come from, we say Eso.
Okay.
I'm from Ijebu. Yes, we say Eso. How do you say hello?
So I'm from Ondo State. We say Aleo.
Aleo. Awesome. Okay, so let's begin this conversation by starting with you, Abimbola.
Okay.
We know that globally there is an eye health challenge, around the world. Can you please tell us about that? And then what exactly birthed VisionSpring in the first place?
All right. Thank you so much, Abiodun. So the burden of eye health issues all over the world is staggering. You have about 2.2 billion people around the world with different eye health issues. And it's important to know that most of these people don't have access to the eye care they need or are not even being detected to have these eye issues. And what's really birthed VisionSpring is the need to provide accessible and affordable eyewear. So Jordan Castle, who is our founder, is an ophthalmologist, and he was on a medical mission field where he came across a young child, a 7-year-old child, whose parents actually felt was blind from birth. But upon him carrying out tests on this child, he found out this child just had myopia, which could be corrected with this 700-year-old technology called eyeglasses. And, being able to provide the free glasses to this boy, he could see the difference in the expression on his face, being able to see for the very first time in his life. And it dawned on him that there are several people like that around the world, 2.2 billion, like I said, that the only barrier between them and being able to earn or learn or their safety is just this 100-year-old technology, which is eyeglasses. So he decided that we have to replicate this in all the other markets across the world. So that is what birthed VisionSpring.
Wow. And, the story...
And the story continues.
Yeah, right.
Yeah.
Okay, so let's hone down to, since we're here in Nigeria, what are the things that VisionSpring has done in Nigeria? How have you worked with communities in Nigeria? I know you have worked in different regions. At least I know for sure Lagos, you've worked in Oyo, you've worked in FCT, and perhaps other ones. What is that work that you have done, and how have you been engaging communities to ensure that they have access, to these eyeglasses?
Okay, yeah. So coming back home to Nigeria, the impact we've been able to make here in Nigeria has been rewarding. So far, we have started since 2016 here in Nigeria, and we've been able to screen and provide eyeglasses for over 400,000 individuals,
Wow.
So that has been rewarding, and we've recorded several success stories. And one important one, or one example I would like to, mention is of one of the ACT Foundation camps we had in Abuja. We had this tailor who felt, in his literally translating from his local dialect, he said he felt his eyes were gone because he could no longer thread his needles. He could no longer read, his tape rule. So he couldn't produce anymore, and he couldn't even train people who were sent to, his students. So he felt his life was over. But we had one of the vision screening camps in one of the areas in Abuja which he attended. And then, with just a pair of glasses, he could, regain his sight. And, this was very phenomenal for him because he felt his life was over. But he didn't know that simple act, could help bring back his income and his livelihood. So these are kind of success stories we've been able to get across the countries, across Nigeria, especially because we have been able to have camps in over 11 different states in Nigeria. Yeah.
Awesome. Okay, so I'm picking on the camps that you have now. How exactly do you reach people through these camps? Do you get them to come in, or do you reach out? What exactly do you do in these camps?
Okay, so we take the eye care to the people.
Awesome.
Yeah, so that's most important to us because VisionSpring is about providing accessibility to eye care, which means you have to take it to their doorsteps.
Awesome.
And these are for people who, can ordinarily not afford, eye care or any form of healthcare in the first instance. So we take these camps to their doorsteps, and which means we have to partner with a lot of stakeholders. In this case, you're talking of community leaders, you're talking of the government, you're talking of the primary healthcare, we are talking of community health workers. So we have to partner with a lot of people, at these primary healthcare levels, to be able to engage these communities, to bring them out to the camps for the eye care. Yeah.
Awesome. I also like the fact that you had touched on the partnership and collaboration. I heard you talk about community stakeholders, even the government, because really, as as in the non-profit space, in the social sector space, for example, we really cannot do these things alone. And I don't know, I don't even know if we've had any episode on this podcast where we never ever talk about collaboration, because it is so key to achieving success. They say together each achieves more, and so you really cannot do this on your own. You really have to partner with other people. And I like the fact that you are taking the screening to the people, as opposed to having them come, maybe from some distance to come meet you and that can already be a barrier. Thank you very much. Kudos for for the great work that you're doing.
Thank you very much.
I want to come to Mr. Ernest now. Could you tell us about yourself and how you came in contact with VisionSpring?
Okay. I am the HR supporting Olam Fleet. We are into delivering products across the country, and majorly our focus is safely deliver products with a smile. And for us to do that, we must ensure that our workforce, majorly our drivers, drive safely. And one of the major constraints that drivers have been having are usually vision. Okay? So it has been a challenge for the organization for a while. However, our partnership with the Federal Road Safety Corps was able to help us in getting contact with VisionSpring, and through them we were able to reach VisionSpring to be able to help us to test our drivers and aid us in terms of glasses, so that they'll be able to see very well and drive very well as well. So.
Okay, so did you attend one of VisionSpring's screening exercises, for example?
Yeah, I attended about 3 of them so far, because they've been coming to the organization from 2022. and it has been a very fruitful and worthwhile session, having them to test me and other drivers as well.
Okay. So since you got the glasses from VisionSpring, what has the experience been like? And I'm talking personally and professionally now.
Okay, the experience has been fantastic, basically, because prior to having these glasses, reading has always been a very difficult one, especially when it's on screen. I have difficulty reading, seeing things that are written, especially those that are not very large. So I have a lot of difficulty. But having these glasses, it has helped me a lot to be able to read and even type. Because most times, if your sight is not good enough, you'll be typing something differently, and you want to communicate, you're going to be communicating the wrong thing. So with the glass, it has helped me to be able to better my job, improve my communication with the workforce. And on professional ground, the glass have actually helped me and my drivers, okay? Because prior to them coming in, we've had a lot of challenges where drivers complain they're not seeing very well. At times when they see light reflection, it affects their eyes. But when VisionSpring came in and did the test and brought out the glasses for them, it has actually helped them and to see road signs, see all those areas that they could not access earlier. And this has greatly reduced accidents and incidents on the road, which is of a great impact to the organization. And that has been very, very fruitful for us.
Great. So I'm hearing not just numbers here, but I'm hearing, the improvements in the quality of life of people just because, of the eyeglasses. And it's so amazing how a lot of people live in ignorance without knowing what exactly is wrong with their eyes. And they just, they just submit to fate. And all they need is just, to go for this screening and get the appropriate eyeglasses to help them function better.
Yeah, definitely.
Awesome. Okay. All right. So, like I said again, I like the fact that you had talked about partnership, collaboration, and it's a good thing. And I really, really want to encourage that VisionSpring keeps it up. I want to move briefly into, these days, there's hardly anything you can do without having technology, without using it to harness your work in terms of effectiveness, in terms of efficiency. So at VisionSpring, how do you harness technology to make your work better?
Okay, so firstly, I'd like to talk about even the eyeglasses in itself is technology. Yeah, so we try to improve because for VisionSpring, we talk of dignity of choice. So in with the fact that we are giving out these glasses either free or at a very affordable price, we want to ensure because you'd realize some people wouldn't use those glasses if they don't look good with the glasses. So you want to provide them the choice, to be able to choose. And so we are even currently launching a new set of designs, for people to choose from. And another innovation in that regards is the fact that we will have pre-cut lenses which can be fitted right there in the camps. And then, that saves us time, for production. But beyond that, we also recently launched the Digitize, which is an app, to help our data collection, to make it more efficient and to make it more for safety of the data we are collecting at these camps, making it more efficient, making it, get to the end where it will be analyzed quickly, which is important because we need, I'm sure you agree with me that we need all of this data to be able to analyze and to plan for future camps and, to also know how and where, the need for these glasses come up. So we consistently improve on technology in VisionSpring to ensure that, and then for the camps also to be shorter, because we try to ensure that everybody has a turnaround time of about 10 minutes in each camp. So data collection as they come in, we ensure that. So these apps are put in place to make sure these things are properly done and with speed, especially. Yeah, so those are ways we leverage technology. And most importantly, because most of these camps are in remote areas, we also try to use a lot of new gadgets which are smaller and are easy to carry around as well. So we always try to improve in everything we do, technology-wise.
Awesome, awesome. Okay, I would also like to know, so what are the kind of responses that you get from the communities, even when you carry out these screening exercises? Do you have you had people who actually do not want to use the eyeglasses at all because of maybe some myths or misconceptions that they have? Or has it always been smooth? So everybody you prescribe to will definitely get the eyeglasses.
Yeah, no, so it's a mix. You always get a mix. And depending on the community, depending on the culture in that area, depending on the basically culture in the different areas you have. So at times you have people who are ready and happy to have you, and at times you have people who have, because some people feel it's for the rich, some people feel, oh, why are they giving us free glasses? There must be something beyond this. Some people, you hear so many funny things like, oh, glasses will make your eyes get worse. So the first thing one of the major things we also incorporate into our camps is education. So we have a lot of trained doctors amongst our teams and with our implementing partners. So we always try to carry out some form of education, patient education, which might be through one of their locals who can speak their language. Yeah, so it's important that we give this information out to them to let them understand that this thing is here to help you and, to provide more information of how it will help them and, ways to care for themselves after the whole program. So, yeah. So it's a mix of the two.
Okay, awesome. Let me come back to Mr. Ernest now. So, in your community, now that you have benefited from VisionSpring, in your community, have you been encouraging people, to take care of their eye health, and how have you been doing this?
Yeah, VisionSpring has actually made life better, virtually for me, the employees. And one of the good things that they have done is taking these tests and these glasses to our doorstep. In our organization, we have different branches across the country, and they have been able to go to Calabar, Kanu, Ilorin to be able to distribute these glasses and test our employees. So all the feedback we've gotten has been very positive. People are delighted that they have this opportunity to be able to have these glasses at little or no cost. So, and if you compare this to going to the conventional hospitals for this, the fees you are going to pay will be very exorbitant. And this has been very, very, very good for our employees and those that partner with us as well. So VisionSpring has been helpful to ensure that those that have eye defect are tested and the remedy necessary in terms of the glass is provided, which will aid their productivity and their sight. So it's been very, very positive, and I'll be an ambassador to communicate this to the communities because it's something that I'm benefiting from. And I just hope that it will not end, because doing such, will I say, philanthropy is something that is cost-driven. And I know that getting funds for such won't be very easy. But I just hope that they continue in what they are doing because it's great and the community likes it.
All right. Okay. Thank you very much. There you have it, VisionSpring. They want you to continue. And that brings me to, so the next thing, which is, so what are your future plans and your goals for Nigeria?
So
VisionSpring?
the future plans for and goals for Nigeria basically is to expand our impact, definitely, because you have over 70 million people now in Nigeria living with some form of refractive error or the other. And so this is not something we can do alone. So as part of what we do in VisionSpring is to catalyze action. So we want to work together with other organizations that have their mission around eye care and that have a passion, to work together with us, to provide the glasses, the basic everybody needs to see beyond, before we even begin to speak about the more complicated eye problems. Another thing is to influence change. And that's why we work with the government, currently federal government, in coming together to make policies, that can help improve eye care here in Nigeria. And that's why we were part of the Jikibola 2.0 campaign last year. Yeah, so another thing is for sustainability of these projects, like the projects we've done with ACT Foundation, we need to ensure that there's sustainability, and that involves also bringing up younger organizations that can continue this at the community level. So we're already doing that, but we need to expand that more, and definitely collaborations with more organizations such as ACT, more partners such as ACT Foundation, who can work and collaborate with us, so that we've reached us 400,000 people. We can definitely do more. Yeah, so we just want to call for collective action so that we can all come together, collaborate, and ensure that, because globally, VisionSpring's goal is that by 2050, everybody that needs a pair of glasses is able to get one. So that starts from every single person that we come in contact with. So it's important that, part of our growth plan is how we are able to reach everybody that needs the glasses.
Okay. Talking about your work with ACT Foundation, I know you've worked with us for, I think, like 6 or 7 years, and still counting now.
Still counting.
Do you want to tell us what the experience has been like?
Okay, so the experience with ACT Foundation has been very rewarding. I would say ACT Foundation has been one of our major partners, and with ACT Foundation, we've been able to screen over 100,000 individuals and provide eyeglasses for these individuals across different states in the country. And this has been quite rewarding, because a lot of the success stories come from a lot of these camps that we have worked with. And still, like I mentioned, we've been able to also empower smaller organizations as implementing partners, to carry out these screenings in different regions in the country. And with our partnership with this World Sight Day, I'm sure, we were able to also reach more beneficiaries. And I know together with ACT Foundation, we can do so much more.
Yes. Right. Okay. So if individuals, people in the communities, if they want to find you, how would they get to know about these camps, this screening that you do? How often do you do it, and how can people get you?
So camps are run almost every day in different parts of the. So we have different types of camps. So we have the ones that run daily.
Okay.
And but most of the time they're, like I said, they are in the communities, which are like in the outskirts of town. But they can always reach us through our website.
Okay.
Yeah, and we also have our LinkedIn page, which is VisionSpring. So we are on social media, basically, so you can generally find us. And those are the greatest, fastest ways to reach us.
All right. Okay. So if you think that you have, issues with your eyes and you need, someone to get in touch with, just look out for VisionSpring on social media, and then you get to know when they'll be having their community outreaches or their camps, so you can access them. All right. That is where we call it a wrap on today's episode. We do hope that you had a nice time. See you again. Bye.
Thank you for listening to ACTPod. For inquiries and feedback, please reach us on actpod@actrustfoundation.org. Follow us on social media at actfoundation_ on Instagram and Twitter, and Aspire Coronation Trust Foundation on Facebook. The show is proudly powered by Aspire Coronation Trust Foundation. ACTPod, our story, our continent.